What are sling procedures for incontinence? Sling procedures are surgical treatments designed to help manage stress urinary incontinence, commonly known as SUI. This condition causes urine leakage during activities that put pressure on the bladder, like laughing, sneezing, or exercising. The goal of these procedures is to provide support to the urethra and bladder neck, preventing unwanted leakage. During a sling procedure, a supportive sling is placed around the urethra. This sling acts like a hammock, helping to keep the urethra closed when pressure is applied. There are different materials used for slings, including autologous tissue, which is taken from the patient's own body, synthetic mesh made from man-made materials, and sometimes allografts or xenografts, which are tissues from donors or animals, although these are less common. There are several types of sling procedures available. The midurethral sling, also known as tension-free vaginal tape, is the most common and minimally invasive option. A narrow strip of synthetic mesh is placed under the middle part of the urethra through small incisions. This procedure is usually done under general or spinal anesthesia and has a high success rate with a low risk of complications. Another option is the retropubic sling, which is often used for more severe cases of incontinence. In this procedure, the sling is placed under the urethra and passed behind the pubic bone, requiring small incisions in the lower abdomen and vaginal wall. The transobturator sling takes a different approach, passing the sling through the obturator foramen, which is an opening in the pelvic bone, through small incisions in the groin and vaginal wall. The surgery typically involves making a small incision inside the vagina, and sometimes additional small incisions in the lower abdomen or groin. A catheter is placed temporarily to drain urine during and after the procedure. The sling is positioned to support the urethra and bladder neck, either anchored to strong tissues or allowed to integrate naturally as the body heals. Sling procedures can be very effective, improving bladder control and enhancing quality of life for many patients. However, like all surgeries, there are risks involved. These can include difficulty urinating, urinary tract infections, and, in rare cases, complications related to the mesh if synthetic materials are used. It's important to note that sling procedures do not address urge incontinence or other urinary issues unrelated to stress incontinence. From the perspective of bladder health and bladder cancer, sling procedures are a well-established surgical option for managing stress urinary incontinence. This condition can sometimes arise after bladder cancer treatments, such as surgery or radiation. Therefore, it is crucial for patients with bladder cancer-related urinary symptoms to discuss their treatment options with healthcare providers. Each patient's situation is unique, and what works for one person may not be suitable for another. Overall, sling procedures representing a widely accepted surgical intervention for stress urinary incontinence, supported by extensive clinical experience and guidelines from major health authorities. Patients considering this surgery should receive thorough evaluations and counseling about the benefits, risks, and alternatives to ensure the best outcomes for their bladder health. Always consult with a healthcare professional for personalized medical advice.